Bonjour. Hello, dear guests and dear colleagues. Welcome to the seminar of the think tank Rational Addiction Policies, called Rational Addiction Policies. Today's topic is reducing health risks from tobacco use and challenges of the illicit market in the EU. We have few speakers, and I'll invite you to discuss. At the end, we have an open discussion. We have few speakers today, but one of them fall ill. Dr. Mravchik is apologizing. So I would like to only, at the beginning, make some kind of framework of what we want to talk about. Illicit market in all addictive substances and products, in which I want to include the illicit drugs such as cocaine and heroin or cannabis still. At the same time, tobacco, gambling or alcohol altogether grows in such size that it's bigger than Gazprom, for example, before the war in Ukraine. Today, and let me say something that I will repeat in my presentation at the end. Only tobacco illicit market is around 20-25 billion euros, out of which 16 billion euros, according to Olaf, goes outside of the European Union. And at this moment, it's not only a matter of organized crime, it's also a matter of undermining states, undermining democracy, undermining European Union, since the money flowing outside of the European Union goes to all kind of troubles such as enemy states or terrorism. Solutions. We're going to talk a bit about solutions. After years of prohibition in many substances and extreme measures in other substances such as tobacco, we see some decline in tobacco, but continuous growth in illicit drugs. It seems that all these punitive and repressive policies is not the only solution, or maybe it's not a solution at all. So the policies, how we actually try to create such policies, are based on one main premise, which is abstinence. And what we trying to promote as a think tank, that abstinence is probably not the only way how we have to create any kind of policy. The opposite, how we can create policies is targeting harms and risks, so minimizing harms and risks in all addictive behavior, we claim is a better way forward. And abstinence cannot be the only choice, but it's part of it. Of course, it's part of it. So harm reduction as a way forward, and what does it mean in concrete areas? I'll talk about it at the end, and I hope we'll discuss pro and against. Is of course looking at the measures that will protect the young people, mainly underage, and of course any kind of preventative measures and any kind of help network that can exist. But as I said, very much interconnect with the harm reduction message, or harm reduction services, as we say, uh, any kind of services that are not targeted only to abstinence, although, as I said, abstinence is one of the choices, but not the only solution. And we also talk about rational regulations, what those rational regulations should be, what actually helps and what is not helping anymore. And one topic that is not spoken about often, we try to push this kind of narrative. We talk about substituted market, not substitution therapy. Substitutional therapy is, of course, very important. And in tobacco, we call it replacement therapy, but it's the same thing. In drugs, we call it substitution therapy. We also have some pilot projects looking at possibilities in this area in alcohol, for example, and we have the same in gambling. But we're also talking about substituted market. And in our view, Czech Republic has last two governments where we come from, Czech Republic, have a policy targeting towards regulating market according to the risks of known risk of those substances that we regulate. Because we have enough evidence today that shows that actually substances substitute each other, not from the biological point of view, but from the psychological point of view. And we'll talk about all this. We also talk today. We will also talk today about some studies that we want to conduct and look at substitution possibilities. And then we have at the end, I hope, some vivid debate. First, I want to welcome our dear guest, member of the European Parliament, Mr. Ondřej Kolář, and thank you for joining us, and I'll give you a floor to say the first presentation or speech.
Thank you very much. Good morning to everyone. It is an honor actually for me to speak, because I don't consider myself a expert on drugs or any health risks. I mostly specialize in international relations and in security. But as illicit tobacco trade was mentioned here, I think it's one of the topics that do actually have to do a lot with security in Europe. So if you allow, I will speak briefly about illicit tobacco as a security risk and a hybrid tool. Now, I also forgot to mention that I'm a non-smoker, so talking about tobacco is somehow new to me. Now, when we talk about hybrid threats or operations, it is actually quite hard for many people to at least imagine what it is. If we are to broadly define hybrid warfare, it is the combination or a combined use of military and non-military means to achieve a state's political objectives or foreign policy goals. And it is true that states which actually perform hybrid warfare usually do this with the help of non-state organizations or stakeholders. Now, weakening a state or a state grouping or a union, if we speak about the EU, a union's economy is one of the most used hybrid tools across the whole world. When it comes to Europe, or more precisely the EU, the last few years have shown an increasing hybrid pressure from the outside, mostly, of course, pushed forth by Russia and its fellows, like Belarus, for example. And Belarus will be mentioned further on today. When I mentioned the weakening of a state's economy, supporting black or illicit markets, smuggling, and gray zones in economy, these are the traditional tools that have been with us since the dawning of the ages. Illicit tobacco markets in the EU have experienced notable growth in the past 6 years, with counterfeit products playing a very significant role, unfortunately. Illicit trade rose by 3% in 2023, with more than 35 billion illegal cigarettes consumed across the 27 EU member states. Now, this illegal trade costs European taxpayers some 16 and more billion in lost revenue. 16 billion and more euro, of course. The trend is unfortunately not slowing down. The most affected countries in the EU are those with higher tax markets, such as France, for example, which itself accounts for nearly a half of the EU's total illicit cigarette consumption. Organized crime groups have expanded their network of illegal cigarette factories across whole Europe. In the Czech Republic, I think where I am from, 3 such factories were discovered in 2022 or 2023. And in the same year alone, law enforcement data shows that authorities disrupted at least 113 illegal cigarette manufacturing sites across 22 European countries. Now, that is a huge problem, of course. Interpol findings also reveal that many of these groups that perform tobacco smuggling into Europe have ties to Russian ex-KGB officers who collaborate with Putin's regime. That's a tie to the beginning of my speech when I said that Russia is behind a lot of these operations. Lately, we have witnessed incidents with hot air balloons used by tobacco smugglers being flown from Belarus to Lithuania. Now, it is without doubt that this happened under the auspices of the Belarusian regime, which actually backs up these groups. And the purpose is to stir chaos within the EU, because we've all seen what happened when these incidents occurred. Lithuania closed its airspace repeatedly, and of course, then we have all the threats that I have already mentioned. Illegal tobacco getting into the internal market of the EU, which brings economical problems and also poses health risks to European consumers. Now, Belarus itself, when I mentioned it, stands among the top exporters of illicit tobacco to the EU, together with the Kaliningrad region, which is part of Russia, the Balkans, and North Africa. Now, North Africa, is the region which is mostly supplying South European countries such as Spain and France, which was already mentioned as well. A note to conclude, I will be very brief. Organized crime and tobacco smuggling is a challenge not only to the EU economy, but clearly also to the health of EU consumers. We don't know what quality the tobacco that is smuggled into the EU is. I sometimes compare it to cannabis products that are being sold across the EU, like CBD, which is imported from China, where they have huge plantations, and the flowers are treated with heavy metals, such as quicksilver, which of course poses great health risks to anyone who tries to consume these things. Unfortunately, the approach of the European Commission is very strange, I would say. The European Commission is now trying to push forward a proposal which would in fact delegalize or strongly regulate tobacco market by in fact prohibiting the sale of cigarettes with filter tips. I don't know if this is due to environmental protection or if there is something else behind it, but I guess that we can all agree that this is the worst path that could be taken, since prohibition, as was already mentioned, has never brought any results, only supported the black market. And supporting the black market is not something that I hope the Commission would intend. This is from my side. Thank you very much again, and I'm looking to further discussion.
Thank you, Mr. Kolář. That was very informative, and I think it was exactly touched to the point. So I hope we will have a very vivid discussion at the end about all these findings. I also want to tell all the audience that we will probably be shorter today. We will probably finish around 12 o'clock, not later. So I hope you are all happy because it's Friday. Now I will ask Dr. Kubu to speak about the meta-analysis that we start.
And the HITNU project.
Yeah, and the HITNU project. Well,
Yes,
I'll give you the floor to.
Thank you. Good morning, ladies and gentlemen. I will introduce you the health effects of alternative tobacco and nicotine use project, which we have started forming to respond on the persistent tobacco use, despite there's already enough and well accessible, even health refunded conventional smoking cessation tools. We want to focus on the effects and health impacts which the new alternatives of tobacco consumptions are bringing to the society. We are also looking for evidence which could objectivize the health impacts and effectiveness of the various types of alternative products which are available on global markets, actually either in the medication category setting or various alternative tobacco consumption products available in the retails everywhere. During the development of the project, we were looking on to various fragmented research activities and start to think how to consolidate them to focus on the same objectives. Within that investigations, what would make sense to consider for the consolidation, we got very interested by the actual development and accessibility of various digital biomarkers, which are utilizing the broad availability of mobile devices, which are, either we know it or not, able to collect various health data, which could, of course, be very useful either in research, but also then in personalization of feedback or advices and support to a particular patient. So in general, the project should bring enough data which will be useful to inform the options for development of various new harm reduction methods, but also to inform public health policies, and last but not least, provide the clinical practice with robust data. So with this multidimensional research support, we are combining consumer behavior analysis, where we are trying to get deeper understanding of the various motivation patterns, barriers among smokers, which are prohibiting them or delaying them in switching to alternative products. We also integrate clinical assessments in the project study designs, working with respiratory, cardiovascular functions, which are obviously the two main areas of health risk associated with smoking tobacco. But we are looking for overall health impacts and trying to provide objectivization for those impacts. Thus, we included patient-reported outcomes, which are, let's say, one of the new tools involved in biomedical research, which are getting already interesting evidence in capturing users' subjective experience, because as we all know, there's nothing in healthcare as one size fits all. The overall trend in medicine or new treatment methods developments is the personalized care, precision-based medicine methods, which of course needs to work also with the subjective perspective of the patient and its quality of life changes. I've already mentioned digital biomarkers, which needs to be, of course, validated for a particular health effects, but they are already providing in the areas related to health risk very interesting options, as we will speak, as I will speak later. Of course, working with advanced collection of biomedical data also needs a reasonable data integration. So we are already setting up processes how to combine population surveys data, study cohorts data from the mobile app users. We are discussing collaboration with and also integrate the clinical data, which we will be obtaining in another of the project study. The first study we've launched within the HITNU project is the longitudinal study, use of tobacco and nicotine in the Czech population. The background is that the smoking rates remain in Czech Republic high despite long-term public health efforts and of course the introduction of alternative tobacco and nicotine products. We are also seeing growing use of the new or alternative products such as cigarettes or heated tobacco or nicotine pouches within the Czech population. Thus, we define the study objectives to map trends in the use of various tobacco and nicotine products, analyze the relationship between the product use, socio-demographic factors of the smokers and also their individual health status, and assess the effectiveness of alternative tobacco and nicotine products for smoking cessation. The hypothesis is that the prevalence of the conventional cigarettes and smoked tobacco use will decline over time, while use of the alternative products will be increasing, because at the end of the day, of course, even smokers are focusing on their quality of life and seeking ways how to keep it despite not able to stop smoking. Also, use of alternative products where is no combustion, which is poses the highest health risk, obviously, will be associated with improved subjective health status. And that the alternative products will be effective, in fact, in smoking cessation, in other words, reducing the harm from the smoking of tobacco. And we will be seeking or trying to objectivize that hypothesis that should be evidence also in reduced consumption of conventional cigarettes and tobacco. The longitudinal study is designed into two main arms, which are going through repeated cross-sectional survey. It's a representative sample of the Czech adult population and sample of adults who have used any tobacco or nicotine products in the past 12 months. The design of the study collects the data via online questionnaire, which uses the representative population panel Talk Online. Each survey arm will be tested in 6 months intervals, and the test will be annually repeated for next decade. There is a questionnaire covering product use, health, and demographics of the participants. And sorry, can we just step back? Yes, which is user-friendly. Depends, of course, on the arm. For the representative sample, it's shorter, and of course for tobacco users it's a bit longer, but the filling up will not consume more than 30 minutes. Yes, please. In the second study preparation, we started to investigate the digital biomarkers, which are already bringing quantifiable, digitally collected physiological and behavioral measures that explain influence or predict health-related outcomes in various diseases or conditions where these digital biomarkers were already tested or already defined and are used in practice. Of course, the development of such digital biomarkers needs a multidisciplinary collaboration, where, from my personal experience, I must say, sensor engineers are very important, of course, according to the biological data which should be collected. Of course, there's a strong need of data scientists to be able properly integrate the various data sources, and last but not least, have clinicians on board to ensure that the developed digital biomarkers will have clinical relevance, will be technically feasible, which means that they have to simply fitting into the actual clinical practice. They cannot bring any extra workload, and of course be usable. The process selecting the appropriate sensors involves also training machine learning models, which are then able to work with the multifaceted data to derivate the best candidate biomarkers, and then the candidates have to go through rigorous clinical validation studies. And such process brings various key challenges, including to manage the high data volume, which the various biosensors, which are already used in various areas of medicine, are bringing for the analysis. It also has to work with the variability across the patients. Not everybody is able to follow every process which might be associated with using the sensor properly, and in fact providing reliable data for evaluation. And there is, of course, continuous need of ongoing validation of the technologies which are evolving, because typically preparation and launch of a clinical study takes at least months, typically years, and the technology development is already so fast that if during the preparatory process there is not properly monitored how the technology already evolved, it can come to the practice with already outdated technology. Digital biomarkers are enabling continuous real-world monitoring of various health parameters, which are supporting early detection, risk stratification, especially on some individual personalized conditions, and of course implementation of sustainable preventive intervention. There are already a lot of examples. I'll mention just two that there's already strong evidence that in the mild cognitive impairment and neurodegenerative diseases, the passive data collected from smartwatches and active digital cognitive tests are already able to accurately diagnose up to 85% for certain modalities which are defining the pretty complex conditions of these type or of this disease group. Also in the area of cardiology, digital biomarkers from cardiac devices have demonstrated improvements in mortality, arrhythmia detection, as well stroke risk reduction when developed, tested, and implemented to the clinical practice properly. The wearable digital health technologies are also bringing evidence of empowering patient in self-management and helps the patient to facilitate precision health by enabling the tailored intervention and proactive care, be involved in supporting their behavioral change. And also the digital biomarkers are already proved in various conditions that ultimately support healthy aging and reducing disease burden for public healthcare systems. Pardon me. This chart shows a good overview of where we are actually in biomedical research with defined digital biomarkers. Of course, majority of them is based on some of the listed in fact standard diagnostic procedures like electrocardiogram or electroencephalogram, electromyography, measurement of heart rate, and they are from these collection points, of course, flourishing into the various application areas, defining for some of the diagnostic or classic diagnostic method, multiple digital biomarkers which can inform about the patient health status. We are working on a so-called validation study within the HITNU project, where the digital biomarkers for COPD will be validated and tested to predict health risk in smokers and users of alternative nicotine products. Obviously, the chronic obstructive pulmonary disease is significantly influenced by tobacco use. Its early detection of disease progression is crucial for any harm reduction and prevention activity, and also gives a more sensitive period in smokers' life when the COPD decompensates. Of course, the people start much strongly and are much more motivated to reconsider how to reduce the health risk they are getting from the smoking of tobacco. There are multiple digital biomarkers which could be monitoring the progression of COPD, like cough, acoustic recording, heart rate variability connection, which is typically measured by the smartwatches, for example. And despite majority of the smartwatches is not certified as medical device, there's already a lot of evidence showing that to measure such a digital biomarker the smartwatches are providing, let's say, good enough quality and reliability of the data measured. And there are also other vital signs which could be taken out from different variables, altogether enabling continuous non-invasive symptom and physiologic monitoring of the patient status. And we are planning to also measure conventional biomarkers of smoking like NNAL, cotinine, SICAM1 or 8-iso-PGF2, providing objective evidence of exposure and harm created by smoking. The objective of this study in preparation is validate correlation between digital biomarkers and traditional exposure harm biomarkers in chronic obstructive pulmonary disease patients and healthy controls. And access predictive value of the digital biomarkers for COPD exacerbation and cardiovascular risk. The hypothesis we will be testing within this study are that the digital biomarkers called HRV and vital signs correlate with the traditional biomarkers, biochemical biomarkers, and spirometry, which of course will be also one of the objectivization diagnostic. Digital biomarkers then can distinguish between exposure groups, smokers, alternative product users, abstainees, and healthy controls, and predict adverse outcomes of smoking. To be able confirm or decline the project hypothesis, we are designing the validation study as prospective observational multicentric study with 4 parallel arms: smokers with COPD, obviously also alternative nicotine product users with COPD, non-smokers with COPD, which is very important group for the validation, and as well the healthy controls. The drafted inclusion criteria of the study is age between 40 and 75, COPD confirmed by spirometry, or of course healthy status, so COPD decline by spirometry, ability to use mobile wearable devices, and consent to collect blood and urine samples during the study. Expected study procedures start with initial assessment of the patient smoking and health history, spirometry diagnostic, and first round of biological samples collection. Then the digital monitoring of sound of cough records, which will have to be, that's one of the practical example how important is for such studies to involve technological expert early enough, because the first idea was that the available recording capabilities in the mobile phones will be good enough to be able to collect such chord sounds from the patient home or his natural environment. But for the goal of getting reliable data or records of the sound chord, which will be quality enough for the validation and selection of the sound record characteristic and patterns for the further prediction. It turns out during the preparation of the study that we will simply have to work with one defined microphone, and the study subject will have to be coughing in the during the visit of the physician or of the clinic involved in the study. Otherwise, we will get a lot of unstandardizable data, and the selection of the proper or the validation of the cough records as the digital biomarker to predict decompensation of the COPD at smokers or nicotine product user will in fact not be possible. We will be, of course, repeating the biomarker sampling during the repeated patient visits, and also patients will be filling questionnaires listed here. For the data modeling, we are already including multivariate regression, of course, involving machine learning and correction for the exposure of the smoking, and also the phenotype stratification, which the patient history and the other objective diagnostic should provide. Expected outcomes are the correlations between the digital and biochemical markers, which we will be monitoring. Also symptom changes, differences in between the 4 testing groups, and identification of risk via the digital tools. After we will succeed, hopefully, to validate the digital biomarkers for smoker, where during the available peer review literature we confirm that it's despite there are already caught sound records validated as digital biomarker for COPD progression, they are not specifically validated for smokers and for, of course, the alternative tobacco users. So the actual COPD digital biomarker could be used only with healthy status, with healthy patients developing, non-smoking patients developing COPD. And that's, of course, one of the reasons why we focused on bringing this very interesting digital biomarker to be usable also within smokers. The technology provides then accessible, non-invasive and continuous monitoring for the patient, because once the bioindicator is validated or will be validated, then the patient can use it from its mobile device. It will not have to be again just recorded in some standardized environment. It's important just for collecting the data for the validation purpose. And it should lead the smokers to reducing the risk of exacerbation and hospitalization, because they'll be getting personalized feedback early enough so they can actively act and prevent the decompensation of COPD. Also, the heart rate variability measured by wearable biosensor is a sensitive marker of autonomic nervous system dysfunction and cardiovascular risk in smokers. When the HRV is decreasing, it means there is a higher smoking intensity in place, and of course can also help to predict increased risk of cardiovascular complications for the particular patient. Regular monitoring of the heart rate variability will allow the identification of early changes in cardiac regulation, which is also already evident in supporting personalized prevention and potentially motivating lifestyle changes, which at the end of the day is the most important thing in treatment of different chronic conditions, because without the lifestyle change, diseases like obesity can't in fact be solved, and it's the most complicated part of bringing sustainable and effective treatment, despite we know how the lifestyle change should look like, to motivate the particular patient to really start and maintain such lifestyle change is usually the cornerstone. Integration of the validated digital biomarkers into the routine care will enable the personalization in early warnings, which are targeted, which can then bring the targeted interventions and long-term monitoring of the smoker's health, reducing the morbidity and mortality associated either with COPD or cardiovascular disease. Thank you for your attention, and I'm looking for your questions in the discussion.
Well, thank you very much, Dr. Kubu. I'm thinking I'll do a little bit of change in the way we're going to deal with it now. I would ask everybody in the attendees if you have any questions, not comments, because comments and debate will be at the end after I come back to the whole topic of illicit market. But at this moment, only questions to the to two guests. As I see, still the member of the parliament, Mr. Koras, is still here, and Dr. Kubu. I just before I allow the questions, I will say a couple of comments about these presentations, which I should have probably mentioned before the presentation. Why we choose this study. To also present in the context when we talk about illicit market of tobacco and the whole harm of it, is that the Czech Republic at this moment is actually the fastest drop in smoking country in the whole EU. We're still high in the smoking, but it's dropping rapidly. Not because people would stop using nicotine, but they replace it. They substitute it with something that we call alternatives to cigarettes. So the debate whether it is a good way forward after Sweden dropped to only 5% of people of the population smoking, adult population smoking. We see all the health results, such as drop in lung cancer, drop in heart diseases, and premature death. We still have this debate whether alternatives and substituted market and substituting the cigarettes for alternatives is a way forward. We believe it is a way forward. We also have some significant drops in health issues, but that's why we said, okay, let's look at the whole possibility, while we resolving also the issue of growing illicit market, whether it is with cigarettes or with those alternatives. So this is one big area of debates and issues and a lot of ideology around that. And I think it's quite important to tackle this kind of issue. If we say, okay, let's calm down on the illicit market with certain activities. I'll talk about them later. Support substituted market, for example, with differentiation of taxation, that cigarettes can be still high taxes and lower taxes on alternatives, and few other measures. are we on the right track? Well, I'll talk about some of my issues in my own presentation, but if you have any questions to Mr. Kolas or Dr. Kubu, here is a space. Just questions, please, and then we have debate at the end.
If I may, I have just a quick question to Dr. Kubo. When you're mentioning about your the study, what wasn't clear to me is how long this is going to go on for. I noticed that you've got 2000.
Hello, everybody, again.
Hello.
So, hello, everybody, again.
And now you should hear us. No, still with the echo. Well, so we brought practical evidence why the modern digital technologies have to be validated to inform in so important feedbacks as a health status, because you never know when the soul in the machine will act.
Just asking for how many years is it going to go on, and maybe the other question. Yeah, that was the question. You have 2000. That was the cohort.
Yes, that's the longitudinal study.
That some follow-up will happen for a whole decade. So but this is the follow-up. So your initial now longitudinal study is going to happen for how many years? Or how is that?
That will be, in fact, the 10 years.
In total.
And in each year, the cohort will be retested. And we will not be, of course, running the both retest simultaneously. There is a testing after 6 months in the longitudinal, but because we have the two arms, so there are like 2 testings per 12 months. But for the subject, either in the cohort 1 or 2, it's just once per year. And in next year, again, repeated the same questions. And this repeats for 10 years consecutively.
So then at the end, there will be some sort of publication, I assume.
Yes, but there will be also we will be doing publication from the continuing analysis once we will have first comparisons and see if there are some so we do not need to wait 10 years to publish the data, but of course after the 10 years there will be the overall analysis of data published, but in meantime we expect there will be published some intermediate observations.
Okay, I have a question to our dear member of the parliament, Mr. Kolář, if I may, myself. I don't want to jump queue if there was any queue, I'm not sure. What you mentioned about the undermining EU and the states because of the illicit operations, is there any kind of activity within European Parliament, mainly? Of course, you mentioned Commission looking at totally different issues, like looking away from it. Is there any activity in the European Parliament that is trying to raise this issue?
Thank you for the question. To be completely honest, nothing such has crossed my mind.
Okay, thank you very much for your answers. We will keep fighting together. We're here so close. So you see, we're friends, but we're also friends in fight. But anyway, any other questions? Please be brave to open your questions.
Hello, if I may ask a question.
Yes, of course.
I think this question is more intended to you, Mr. Bobožel, and Mr. Kubu. I would like to ask, how can we guarantee that the research on the risks and benefits of the new nicotine products remains independent and transparent?
I would say that by designing robust enough objectivization in the project of validating the biomarkers, there is that expected correlation, and if the data collected and the multivariate analysis will confirm the hypothesis, then we know that the given digital bioindicator can be used into practice.
And of course, any ethical commission and the whole design of the study.
Indeed. The proper approval of the clinical part of the studies, and also the collaboration with the experienced technological partners which already have working experience in utilizing such procedures, either in medicine or because we are working here with Czech Technical University, the Faculty of Biomedical Engineering, and they've already proved to validate and implement different digital biomarkers, which are, for example, now used in practice of fire brigades, and it helps to manage their physical ability during the complicated conditions they are fighting in their work.
Okay, thank you so much.
It's funny how we portrayed it here. Any other questions to both speakers? I was quite struck, I have to say, by what our MEP says very clearly, how it's clearly connected with hybrid war. So if any questions towards this is in your heads, please don't be afraid to ask. So we'll still wait.
Sorry, yes. if I just may, to me, maybe this is to Mr. Kolar. It seems like a paradox, the fact that security at EU level becomes the key issue, the key entry point to resolve or to address an issue that is really very much health related. Like, for example, the fact that smoking, I know we're talking about illicit tobacco, but also, for example, illicit tobacco, if it's traditional cigarettes or alternatives, we don't know how much harmful they are to the health of EU citizens.
Okay, one more question if there is. If not, then I'll go to my presentation. One more question, if there is any. If not, then I'll go to my presentation.
Say a long comment that has
So we could not hear properly. So can you repeat it again, please? We are back in the studio.
Miss Gabriela Sierra Fontecilla has sent very interesting information about Spain and issues. Maybe I don't know if the Swedish government. Some asking about your thoughts on a number of issues that she has brought up on the chat.
I don't know. Ty rozumíš?
V chatu máme nějaké další otázky. Yeah, we just need some technical assistance to open the chat. Yes, now we see it. Wow.
So can you read it, or shall I read it?
Yeah, let me read it so you can start preparing answers. Thank you to speakers and organizers for this very interesting event. I was aware that Spain consumes so much
was
illicit
not
tobacco.
aware.
I wasn't aware, thanks, that Spain consumes so much illicit tobacco compared with other EU member states. However, the Spanish government has recently begun a broader campaign against smoking and tobacco products in general.
So our studio is there is ghost, but there is a whole legia of ghosts.
Yes, we can hear you.
Okay,
Yes.
so we probably need the questions.
Yeah, unfortunately, we don't see any more the question.
Okay, I will maybe if I read them for you.
Please.
So, Ms. Sierra Fontecilla is mentioning that she wasn't aware of Spain consuming so much illicit tobacco compared with other EU states. However, the Spanish government has recently begun a broader campaign against smoking and tobacco products in general. In this regard, the new law they intend to adopt would ban single-use electronic cigarettes as well as other products such as chewing tobacco. It also aims to drastically limit consumption by prohibiting smoking on terraces and in public spaces, and even by shutting down private smoking clubs. This would reportedly also affect cannabis clubs and CBD products. And now is that example of the Swedish government. Shall I continue? Yeah. The Swedish government has reportedly sent a letter to Spain warning that these measures may contradict the EU legal framework. It's a very interesting issue. What are your thoughts on this? What can we do to create international pressure or prevent these measures from being adopted? And then it continues about France. Maybe this could be the second question.
I think even and this is a number of questions actually.
Yes.
One area is the ban in the public spaces. I'm not against banning the public spaces because that's very much that is very much the issue of protecting non-smokers being exposed to smoking. But the way we did it in Czech Republic 2016, when I was a national coordinator of Czech Republic, envoy of the government and directly accountable to the prime minister at that time. So when we did this kind of anti-smoking law, where we banned smoking in public spaces and restaurants, all restaurants, we allowed exceptions. One of the exceptions was electronic cigarettes. The law says it's in the hands of the owner or the provider of the service to decide whether they want to also ban electronic cigarettes or other alternatives. We ban cigarettes as such. That doesn't result to any drop of smoking. If anybody thinks that this is any major regulation or measure against smoking as such, that's not the case. But of course, it protects people, especially people working in those spaces, restaurants, waiters, because there is many places where people are protected against any kind of exposition of the environment in which they have to work, but this was not the case. So this is quite important, and yes, it can, for some people, reduce the frequency of the smoking, but not smoking in itself. But in terms of banning alternatives, I mean, if we allow cigarettes to continue and ban alternatives, what does it say? I mean, this is for me incomprehensible decision. Even if I take the alternatives might have similar risk, which they don't have, but even if I take it, so how can I justify this, and I think the Swedish warning, warning of the Swedish government is also relevant in this case. um, I think they, as I said at the very beginning, if we want to include, if we want to take real measures to reduce the harms of smoking, because we don't, if smoking or any kind of use of any substance doesn't pose any big risk, why constraining people? Why should government or state have any say in such private thing as what I'm doing with my body? Yeah? But if it's concerned with public budget, premature death, then that's maybe understandable. But in that case, we have to think of what actually works with reducing the risks, not the use, but the risks attached to it. Because who cares about the people's behavior if it doesn't bring any risks? So, and we see over and over, and I will talk about it in my presentation as well, in different kind of areas, not only smoking, that substituted market, substituting possibilities on the market is one of the major solutions. So if we say, okay, one or the other alternative is not any less risky than cigarettes, I would say, okay, then we have to research and make sure that we bring those alternatives. So another thing that I always been thinking last few years when this debate is on the table, and it feels so irrational and kind of, where is the evidence in my view? Yeah, so we say, okay, the pharma products, we call them a nicotine replacement therapy, which is the same as substitution. Replacement, substitution, replacement, substitution. It's the same word, yes? It's only synonym in this matter. But we say, okay, harm reduction doesn't work in tobacco. Some people say, I mean, a lot of governments. Harm reduction in tobacco doesn't work. Substitution doesn't work. But we allow pharmacological companies to advertise. We don't allow to advertise cigarettes. We don't allow to advertise any kind of alternatives, but we allow to advertise any kind of products made by pharmacological companies. It's the same, it's nicotine. And I've seen so many times that people, because the difference is that you have 4 milligrams of nicotine in those products made by pharma, and 10 milligrams in cigarettes, 12 milligrams in nicotine sachets, for example. So the people use the pharma products, say those stickers, those plasters. Okay, they put 3. They could, or my colleague trying to switch from smoking to those chewing gums, so he put 3 chewing gums. So as much as possible to put enough sufficient nicotine to substitute. If we, and of course the debate about the risks, I mean, we know that 80% of the risk is the paper, because it is the biggest amount of the tar that we put in our lungs. That kills us, it's the combustion kills us. But we still have this debate whether those alternatives should be banned and cigarettes allowed, and advertising for pharma. So I think this is a ridiculous issue, situation, and I feel very much, and I have some facts that arrive from time to time to my hands and to my emails, how much the debate or the fight is stimulated by the big pharma. So let's be honest in that both industries are profit-driven, not only tobacco industry, but the pharma industry, and then they have similar products. With the tobacco industries, made those products a little bit more attractive for the users. So the big pharma are kind of oppressed in this, even though they have possibility to advertise, etc. So I think this is a dirty debate actually. Yes, it's and I'm quite cross with some of those debates saying that those countries that support any kind of substitution therapy and substituted market and harm reduction, which we do it not because of tobacco, but as an overall policy in all addictions. And we started a long time before the tobacco companies picked these rhetorics. When there is no mentioning that there is actually the other side, also not very clean. So anyway, so I didn't touch the amount of illicit the Spain faces with the illicit market, the numbers, because I think it's going to be mentioned in the France, the question about the France, I guess. Yes. So please read the second half of the question.
Sorry. So the second part of the question, but maybe I wonder if Miss Sierra herself would like to ask. I feel a bit bad doing this. I wonder if Miss Sierra would like to ask herself.
And maybe even ask if I was answering the question.
This is maybe Miss Gabriela Sierra Fontecilla is connected online, so maybe you can ask directly instead of unless the microphone there doesn't work. Okay. All right, so maybe I'll read the second part of the question. So the Swedish government has reported additionally, France is considering taxing CBD as a tobacco product. How could we work with national and European administrations to help them understand that CBD, being non-harmful and a healthy alternative to tobacco, should not be subject to the same regime? This principle has already been recognized in Switzerland, but within the EU, the direction remains uncertain. What strategies or coordinated actions could be organized to gain real influence on these issues? We already participated through legislative amendments, but I would like to go further and generate stronger international pressure.
Well, the issue of the cannabis social clubs in Spain and the CBD use across Europe, it's a complicated one. No? It's and I think it's a fair, let's say, point to make, that actually what we're doing with tobacco restrictions also targeting other areas. I mean, the nicotine tobacco restrictions. With CBD, we have the whole issue of some listeners might not know. We have the whole issue that CBD is considered as novel food, but in terms of possibility of using it in vaping or other forms of smoking, in some countries it's considered as smoking. So it has the same restrictions as smoking. Maybe Mr. Kubu can have some other points on this one. And the cannabis social clubs is even more complicated in Spain because federal government in Spain, as far as I'm aware, doesn't approve it, but it's approved in, for example, the Catalan parliament and the city of Barcelona, for example. I'm non-smoker, but and I'm not user of cannabis, but I went to see some cannabis social clubs, and I'm a member of one to see, because we wanted to introduce this to Czech Republic. I think the solution must be a European debate on cannabis. Cannabis regulations in itself are actually divided from tobacco, And it's the trouble is that it's all European different kind of regulations. As I mentioned, CBD as non-psychoactive substance deriving from cannabis is novel food, so that's one regulation, and the THC-rich cannabis products are all banned. So only few countries now allow some kind of home growing, or Germany or Malta is allowing cannabis social clubs, and it's still in the air. So I'm not sure if I have actually answered. Maybe you have, Pavel. but I believe we have one of the members of the parliament here, so I believe it's the same as with tobacco. The prohibition is creating a bigger problem. So the cannabis in itself, since the prohibition 60 years ago, every year only growing all over the 60 years. So we have large gangs, hundreds and thousands of heads operating with around this area. And as we said, why we want to regulate it, because as you rightly said in your question, because we believe that we need to regulate substances according to their risks. Cannabis we see as lower risk, and we rather substitute our market with cannabis than other more risky synthetic cannabinoids or synthetic other drugs. And we see that we have all the data. We have tons of data actually, which show that if we bring some less risky, and I'll again touch on that in my presentation. If we say bring some less risky products on the market, they replace the higher risk, and the other way around. If we ban them, higher risk products come. So I'm not sure if I'm answering your question, but because there's so much in the air. But Pavel, maybe you have some thoughts on this one.
Yeah, well, of course, the actual non-clear status of not just CBD, but also other cannabinoids on European market is creating a lot of disruptions and enabling demand for various alternatives with this regard coming from synthetic productions not listed anywhere, and in fact bringing unknown risks for their users. So shutting down the broad CBD availability across Europe will probably not help that situation. At the same time, you already mentioned it's pretty complex area. It's unfortunate that the CBD did not succeed early enough to get the novelty food status, or prove that it should not be listed as novelty food status. At the same time, there should be some rationale of us, and the regulations should consider the risks of the molecules and not just banning some molecules availability because of administrative requirements, and in fact enabling space on the markets for molecules with so far unknown risks. Because we already know that non-ban changed any demand in this area.
So if I may, I go to my presentation, and then we will continue with questions, answers, and debates and thoughts. Before I start my my presentation, I will.
You cannot hear right now.
Okay.
Microphone is off.
Okay, 1, 2, 3. Can you hear me? Yes. Okay. Good. 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 Finally. Before I start, I look at some catching phrases in ChatGPT. We have to involve AI today in things. Yes. Just let me to lighten this topic up a little bit. ChatGPT. You can arrest your way out of addiction. Regulation saves lives. Prohibition only hides the problem. I like this one. Smart policies, not fear-based reactions. And I like the Mr. Kollar's sentence. I wrote it down. Where did I put it? Who says, let's not confuse security for defense. I think this is a new phrase that I'm going to try to remember and incorporate, if you allow me, Mr. Kollar, in my next speeches, anywhere I go with this. So let's look at my presentation, please. So next slide, of course. So drugs, tobacco, and alcohol is one illicit market. I think this is quite important to underline this, and I will touch on that several times. Money flowing from this illicit market we mentioned goes to outside of European to hands which we really don't want to go to. Yeah. But also we need to mention that the illicit market, counterfeit production of tobacco, production of heroin, cocaine, or smuggling in heroin and cocaine. Today, illicit market in gambling, which is enormous, often, or human trafficking, for example, is often in the same hands. We can see the tracking links to several areas. We have some actors in this in the European Union. I will mention that, but we also have actors interlinked with these organized crime groups outside of the European Union, and often with the enemy states or any kind of authoritarian states. I mean, you can remember recently the fall of the Assad regime, and then millions of tablets of Captagon found, and we know who was the defender of the whole regime and how these kind of things were distributed. He went all the way to all kind of ISIS forces and all kind of terrorist groups, etc. Yes. So the result of the whole growing of the shadow economy is not only tax revenue drop or money flowing to hybrid, but it's also violence, corruption, destabilization, internal. We know that we speak today about the situation of cocaine in Holland and Belgium, how they face a new situation with the corruption. But make no mistake, these are the same groups: illicit tobacco, illicit gambling, cocaine, same groups. Okay, let's next slide, please. In Europe, if we look at the tobacco, 25 billion cigarettes, 25 billion euros is lost annually through illicit drug, tobacco, and alcohol market. That's a Olaf and Euromonitor 2023, and now it's even worse, the new data. Tobacco smuggling now overlaps with synthetic drug routes and alcohol counterfeiting network. So it's actually one system that combines all this. Of course, there are many fragmented groups, but overall, we need to see where the money flows. This money often finance political influence operations, and of course, the money are laundered, so it gets lost in the system sometimes, so it's very difficult to track what's happening, and we can see that the risk is growing. Let's see at the next slide, please. So the facts, yes, 39 billion illicit cigarettes in the EU, 2024. Across the EU, it's 10%, but in some countries, it's much higher. Czech Republic, it's almost 20%. So that's why we are banging with the alarm at this moment, because we don't want to go the direction of France, for example, where you have 37% of market with cigarettes illicit. The losses reached, as you can see, annually now already to 16 billion euros. So, and it's growing, yes, it's a trend. It's not only that it's a one-off, it's a trend. So it started growing with 3% in Czech Republic to 8%, and now we are 18% within 12 years. Olaf operations, as you can see, 530 million illicit cigarettes, 20 tons of raw tobacco. I mean, illicit cigarettes, if you think about it, we produce illicit cigarettes, okay, inside of the EU. As we know, the machines are not very expensive. It's actually a few €100,000. But somebody has to bring the illicit tobacco to the EU. So tons and tons of illicit tobacco coming from outside of the EU. So imagine how very well organized the operation must be if we know that there is around 150 illicit factories in the EU, which grew only last like 12 years in the EU. But somebody has to supply it with tobacco, which most probably comes from outside, and then somebody owns or organizes the whole distribution across the whole EU. 400 million people, 450 million people in the EU can actually access illicit cigarettes, no problem. So how well and how large it is organized. Yes, you can see the 12.7 billion sticks, 36% of illicit trade. And as I already mentioned, the situation in France alone accounted for 48% of total illicit consumption. But it's spreading in different countries. As I said, in Czech Republic, it was very low 12 years ago, and now the illicit market grew, and it's growing across the Europe in other countries as well. So we counted that Czech Republic has about 75 million losses on tax revenue every year now, and the illicit market is about 18%. There are different kind of numbers. So I already mentioned the illicit market group, the organized crime. There are two groups specifically mentioned in the reports: the Galician Mafia and the Camorra, the Italian people. But what is not mentioned very often in the European reports, and I don't know why, if you look at the declassified reports from CIA, it clearly points out at certain figures connected to the Russian Kremlin leadership. Certain figures connected to the Russian Kremlin leadership. There is a report on Mr. Ivanov, who was the national drug coordinator not long time ago, who was accused by their own people. If you remember the Litvinenko case, who claimed that Mr. Ivanov was in charge of cocaine and the heroin routes. And he was at some point, that guy was even, I met him personally a few times, yes, but he at some point he was the chief of staff of the president of the Russian Federation. So this is actually warning us where the money goes and what's actually going to happen with all these losses that we say. And as our MEP said, let's not confuse security with defense. I think this is a big threat of our states, of our democracy, and of course of the undermining our defense mechanisms. As we already mentioned, the hybrid actors linking criminal terrorists and state interests. Olaf itself identifies illicit tobacco as the major source of organized crime within the EU, directly undermining public trust and fiscal integrity. So I think this is something that not touching this issue on the EU level, not raising the risks that are posed from this area is the major, let's say, misconduct of any kind of public actor that gains this information and does nothing. I'm a little bit critical. I can be now critical because I'm outside of government and I'm just the leader of a think tank, so allow me to be critical. So regulations, what can we do in terms of illicit markets? So there are some basic things that we mentioned: integrate tobacco and drug market regulations into the EU internal security strategy to undercut criminal economies. To simplify it, we need to take this as one thing. As again, Mr. Kolar said, when I ask, can anybody do anything from the European Parliament or Commission, and he mentions, well, when the Olaf says, puts their report, it's fragmented, so the counterfeit tobacco is one of the many issues. But if we look at this issue together, these are the same people, same groups that are involved in human trafficking, in cocaine routes, and tobacco counterfeit production or counterfeit production of medicines. We have a recent report of another think tank called Globsec, if you want to have a look, which speaks about Russian operations, economic operations, buying inside of the EU with some kind of, as we call them, white horses, people who act as European citizens but are actually connected with Russian money, and they're buying pharma distribution. And then when we look at the counterfeit pharma product, again, it's growing. So we should look at all these issues not separately, but draw them up and how much this is interconnected. Of course, expand track and trace system to cover alcohol, raw tobacco, filters, packaging, materials. It's one of possibilities. That's a big debate about it, but I don't want to go into detail with this one. And one of the questions that is raised by a number of countries: harmonize excise policies to reduce price gaps that sustain smuggling routes. Now, we point out about the trouble in France. France says we have the trouble because you have lower taxation. Now, there, let's look at the economics of the whole thing. The counterfeit product of the whole thing, the pack of the whole pack of cigarettes, including the packaging and everything, costs less than €0.5. It's even quarter of the euro. Now, we know from the WHO that higher taxation actually stopped the epidemic. It's one of the major measures we took. But some of the economists said, but don't overdo it. If you overdo it, then you will have growing illicit market. So there is a limit to how high the tax should be. Yes, I agree, and most of us would agree that having the same policy across the EU would help, because number of the illicit and the smuggling of the cigarettes is because it's cheaper in Poland, so it's smuggled to Czech Republic, but it's reached its ceiling, approximately 6% and no higher. So the rest is a different issue. So in France, the tobacco, the pack of cigarettes is around €13. Sold on the streets, the counterfeit tobacco for €6. In Czech Republic, the official tobacco package with the label and all the taxes paid is €6. So this is a big gap, and of course it can play some role into smuggling to France. But what the research shows, or what the data shows, is the main area of growing is not smuggling from one country to another, official production, but not taxed, or taxed in one country less, and smuggled to other countries, yes, but it's reached certain level. As I said, 6%, but what's actually happening is growing enormously, rapidly growing the counterfeit production. And I think if we don't accept that we have to kind of, if we think of the level in the taxes, we have to kind of think of illicit market production. We will be in the same situation. Even if we level it to the level of France as they want it. Okay, everybody has €13 for pack of cigarettes. Are we going to head to 37% of illicit market if we do it? And I would say there is a risk. The idea that if we level it to €13, the illicit market will disappear. It's obviously nonsense at this moment, seeing the amount of illicit factories in the EU. So the debate should be there, and harmonizing it should be one of the solutions, but has to be rational and data-based, evidence-based. Invest in the anti-corruption and financial intelligence unit, trace laundering network across jurisdictions. Yes, of course, this is one of the things that the justice side and the interior people say we need to do it, and yes, one of the things has to happen that it needs to become a priority. Not only that we have to do it, yes, we keep saying we have to do it, but we have to maybe have less operations on illicit um, cannabis and more operation on illicit tobacco. I mean, change the priorities within the customs, within the police, within all the institutions, in the anti-corruption institutions, and look at the biggest threat. And this is actually one of the biggest threats. In my opinion, also, the whole debate on tobacco is so driven by health professionals, and I am a health professional myself. So for many years, when I heard taxation, I closed my ears as a regulator. But I was also always following in my office before, when I was under the Prime Minister, following the enormous growth of the illicit market, and I said, come on, we have to rethink that. So it's not only health risks, but at this moment it's a security defense type of risk. And in the situation of the biggest war since the Second World War in the European continent, we cannot ignore it. Of course, support whistleblowers. I think this is a debate that I want to discuss much. Let's look at the next slide. But the whole, let's say, solution must not be separated with something that I forgot to put the word in there. Without a substituted market, that's half of the solution. Half of the solution is substitute market with less risky products. If we don't have, let's research and bring them. It's actually irresponsible not to put money in such research. Let's substitute market in such way that we have lower taxation, not the same taxation on this than on cigarettes, and the regulations must not be stricter than we have on the cigarettes, which is in many ways the case. In some countries we ban alternatives and support cigarettes. In some countries we have higher regulations, if we allow on the market, on alternative to cigarettes or nicotine products than on cigarettes. So it makes no sense. You can see on the other side the case of Sweden, and as I said, Czech Republic is heading towards it. If we are not pushed to change our policies, then we are the fastest country dropping smoking. But the same way as the Sweden achieved it. You have daily smokers, which is the only country that actually achieved the European Union goal of 5% of adults smokers only. We have mostly 20 and more % in many countries. But in Sweden you have 5%, and we have also all the government data, and I would not, how do I say that, I would not doubt those data, thinking that Swedish government is biased. I think that's I heard this accusation, and another thing is very wrong, because you have clear, hard data on dropping of heart diseases and premature death by 70%. You have more than half of drop of lung cancer drop, etc., etc. So, so they actually achieve something that we only can dream of. So, and of course, the demand on illicit cigarettes in such case is low, when people don't smoke. So why buying illicit cigarettes? I'm not sure if you know the whole issue of Swedish situation where we, during the debate on the tobacco regulation, Sweden wanted to or kind of advocated for an exception against a ban of alternative to cigarettes, which is called snus. So all the people switched to snus, or most people there switched to snus, actually. It's the only country which is allowed to produce and sell it in the European Union. So it's how much this is evidence-based. I think this is a question that has to be asked. Why the rest of the Europe bans something that actually helps Sweden to come down on smoking. And I keep hearing that we should ban Swedish too with snus. I see no reason for that, but I still keep hearing some governments saying, snus is smuggled to our country or whatever. So let's put a pressure on Swedish to come down on this. Next slide, please. So we are at the end of my talking. Oh well, sorry. Let's leave the so I can read it. Rational and evidence-based regulation is a defensive measure to restore transparency, stabilize markets, and strengthen democratic institutions. I think I know it's a very formal way of finishing my speech, but please, let's think about it. So now I hope you will have a few questions or comments on what I said and what was said already by now. And let's allow some time, and then we can finish before 1 o'clock. I'm a trained psychotherapist. One of my psychoperative training was also Rogerian therapy, as it's called. The Rogerians love allowing silence, so I will allow silence until you ask questions.
That in fact the part of the security issue that illicit tobacco is in increased numbers flooding European markets is definitely having also some public health consequences, because we can hypothesize that the quality control of this product is probably not on the level, especially minimizing various contaminations either from the production or from the storage, because again it goes through some illegal distribution channels, so there's probably not invested in the proper storing procedures. And we know that, for example, mold can create a significant risk, especially in already some disease compromised patients. And I believe that also public should be aware of this risk related to illicit tobacco sales and distribution to their health, because they are quite often paying the same price. Of course, I do understand that if they are seeking some extra discounts, then they're probably willing to take some more extra risk. But it's again a question mark how much these people really know. What are the extra risks they should consider by saving few cents or euros? But at the same time, a lot of these illicit tobacco products are sold as the legal products, so they are sold also on the same price point, if I'm right.
Usually under the price, that's the whole point. In Czech Republic, you would buy, because the price of cigarettes would be around €6, so you would buy it for 4. In France, it's 13, so you buy it for 6. So that's why it's growing so much there. Yeah. So that also shows the mathematics that if we all go to 13%, that can be a problem. But anyway, to your point about the health risks. Yeah. So we know that some of the products have all kind of contaminants. And because you imagine a factory which is not a factory, it's a cellar, or it's a metal box where you produce it, because the machine is actually small. You can produce millions of cigarettes every month. So you have rats excrements in what you smoke in. That was found there, really. You have all kind of contaminants. Yeah? So it's not the prime tobacco that is smuggled in. It's the first tobacco you can imagine. I mean, if we probably look at the production site, it's probably going to be, for example, somewhere in Southeast Asia, in a contaminated soil where there used to be production of opium, and it was burned with some kind of chemicals. Yeah, so, and it's in the soil, etc. So you name all kind of horrors you think of, and it's going to be twice worse.
Maybe I've noticed that 2 people have raised their hands. This is, I can see Clara and Axel Klein. So maybe Clara Boboželová, she put her hand first. Maybe we'll give the word to her, and then we'll pass it to Dr. Axel Klein, who is joining us. He's a member of the Global Initiative Against Transnational Organized Crime. So an interesting person to have into the discussion. Clara.
Yes, I hope you can hear me. I'm sorry for not turning on the camera. My camera is not working. I hope I don't offend anyone. But I see that Dr. Axel Klein is connected as a member of the Global Initiative Against Transnational Organized Crime. And I would be very interested in hearing his point of view on Jindřich Vobořil's presentation, please.
There you go. So, Dr. Klein, I think the floor is yours now.
Sorry, I've never had before the question before me asking what my contribution was.
There you go. This was the first time.
Thank you very much for having me, and thank you very much for having this whole discussion in English. I think it shows how well advanced and globalized we are already, that we're all speaking in English as a second language nowadays, including myself. I wanted to pick up on the discussion and a couple of things. First of all, I think it's really right to frame it in terms of prohibition. A number of people in the chat and a number of contributors use this term, and it's always used as a way of critiquing a current system of regulative of regulation. And it says prohibition doesn't work, but I think we need to take it further, because I think prohibition is not just a descriptor for the current system. I think prohibition is really the core element of it. And it reminds me that the way we are working now with tobacco, it reminds me of what people like me who've been in the drug policy reform movement for decades, we used to joke that there would be a time when tobacco was the baddie and cannabis was the goodie. And this is where we are today. Cannabis has become medicine and tobacco has become a demon. And I think we need to really focus on what we are doing, because it is, as the presenters were arguing earlier, it is no longer, when we look at all these so-called tobacco alternative products, and I don't like that term because it gives such dominance to the cigarette, which was a vehicle for nicotine consumption that was popular for 150 years. But tobacco has a very long history in European culture and in global culture, as a chewing method, or there are various forms of administration. But these various forms of electronic cigarettes, of pouches, chewing tobacco, all have, as far as the current research level standards are going, they have very low adverse medical impact. There is no reason for having restrictions, of these draconian restrictions on them. And that there are suggests to us very clearly that it's not about public health, that this is not a campaign about public health. This has to do with something else. I mean, ditto we could say about cannabis. The adverse health consequences of cannabis use, especially when the THC content is fairly moderate, are not severe. And we know this. And we've known it for a long time. And yet the campaigns prohibiting the substances prevail. So we can almost say that the campaigns are running to their own momentum, that are divorced from the outcomes of public health. And now, as our colleague from the European Parliament very clearly pointed out, and again, we've known this, we have related to these public health, so-called public health control campaigns. We now, as a consequence thereof, we have a huge organized crime issue. We've gifted some of our largest consumer markets to organized crime groups. And why are we doing this? We're not doing it in the name of public health. We've proved that this isn't the case. We are doing it because it's running to its own momentum. And I would say that this goes back to the era of prohibition. Prohibition has become a governance model. It's the way that the state or the authorities relate to the citizens of the country. And it's similar. I mean, I like that term hybrid warfare. It was now we have hybrid warfare between nations, but we also have something that's called the culture wars. And here, cannabis particularly, but all the other illicit substances, I should say currently illicit substances, they have been symbols in this hybrid war, culture war between different sections of the community. And we should really, culture wars, it goes back to, in Europe, we have had wars of religion for centuries. And this is similar where we're at the moment. These are a continuation. We're talking about values, about human behavior, and principally about how we like to control the behavior of other people, which is usually what it is. The young people, the poor people, or immigrant groups, but we like to control others. And so this, I think, prohibition is what we would like to sort of focus on, and we would like to dismantle if we can, or at least reform the system, because it's an administrative system that has relatively moderate value at the moment, but huge costs. And this cost-benefit calculation really needs to be undertaken. And we also need to find that prohibition has its beneficiaries who are fighting for it. In large sections of the so-called public health community or the international drug control community are administrators paid for out of the public purse by us as taxpayers to basically to deprive us of our freedom of choice. And therefore we have a citizen's rights to critique and think about dismantling it. Another question, and this is where I would like to ask the question, how do we move forward? We were told to keep on fighting, but how do we do it? These decisions are taken for us by experts who really are not accountable to anybody in public, and they're taken to at European or at global level. And we are usually organizing on a national basis. I know the various cannabis and drug policy reform, or now the vaping movements, are always national. And the decisions are made at a global level. And the question to me really is, and this to the panel, how do we move beyond our silos in order to really gather our own momentum in order to push for reform? Thank you very much.
Yes, if I may follow on this one, I like the idea or the how you phrasing it, or saying it's not a public health but culture war. I think that's very much the the case. We just recently made 3 plants of cannabis legal for home growing. The conservative part of the parliament says the reason why we should allow it is because it became a traditional drug. if it's not a traditional drug, we should not allow it. We should ban it, keep ban. But it became so much traditional drug now, so we should kind of a little bit loosen it. So it's a cultural issue, not a evidence-based solution or decision. So that's very much framing the debate. Some say it clearly like this. Some say it under other kind of arguments or rhetorics, which are usually secondary, only kind of used covering what is the real issue, which is a culture war. I really agree with that, and I think it's a very good point. But I have a temptation to repeat myself with the substituted market. I think this is so important to kind of get it in our heads what actually works. We know what works. We know the substances substitute each other, and I would like to give one more example, which I forgot to mention in my presentation. 2008, we had a situation of growing heroin market in Czech Republic because usually, our drug of choice in terms of injecting drug use in Czech Republic is methamphetamine, which has been produced here for years, called Pervitin here, because it's a German name for it. And since 2008, when we had reached a country of 10 million people, about 15,000 everyday problem heroin users, it dropped by today to 2,000 only. That never was heard of in any EU country in such short period. Dropping of the heroin use down to not zero, but a very low number. And if we look at the people who use heroin today, it's a minority group called Romani group, and a few Russian-speaking. What happened actually? We allowed on the market very available buprenorphine at that point. Buprenorphine is one of the opioid drugs. At that point, we thought it will be for people who are kind of medium heavy users or low dose users. But to our surprise, what happened, because we allow it so easily to be available through GPs, even the chronic long years users dropped heroin and switched to lower potent drug called buprenorphine. Half of the market is actually not legal. it's leaking from the pharmacies, etc. And I have a big argument with the police. I said, listen, don't go down on this, because it's about $200 a month to spend on buprenorphine, and many people start on a illicit market, but then go to a doctor, and the people go to work, they look after their children, they don't have to get involved in organized crime, because heroin costs about $2,000 a month. It shows without the state, kind of, or half of the intervention was done by state, but part goes through the market itself. It shows how substituted markets actually can replace higher risk substances. And with cannabis, we can see the data in different parts of the world, how it, for example, substitutes some medicines for sleeping or alcohol. I don't want to go into big details, but look at Colorado, for example, where we have drop of violent crime under the alcohol. We have growth of road accidents under cannabis, but correlates with dropping of the accidents under alcohol. So it clearly shows, and then a few other measures you can look at. For example, tax revenue in the same state. How it correlates alcohol and cannabis, substances substitute itself. And I think this is one of the major solutions that we can actually, from evidence, bring through the consideration. Let's regulate, okay, but regulate according to the risks. The other question is that you mentioned. Yes, we have a country advocacy, let's say, or whatever lobby we can call it, for changes. But we need something global. If I understand, do you understand it the same way? What Axel said? Yes, you need something global. Yeah, we have, in terms of harm reduction, we have the global action we have international harm reduction associations, but they are very much focused on services. But what we say in Czech, in our legislation and in our national strategy, that harm reduction, it's an overall approach. It should not be only type of service, but it should be approach. We focus on minimizing harms and risks. And these kind of seminars and our presence in Brussels with our think tank, that's our ambition, to create network with people across EU and across the globe to raise the issues of what's actually happening to illicit market and what can we do. We are at the very beginning, but I hope we will pick up the movement. I don't know if I'm answering any of your questions, but this is our thought.
May I just respond briefly? I'm just sorry. I just thought, yeah, that argument about this is not part of our culture. I've long heard, that cannabis, well, yes, it may not be, but it's not part of our culture. It's not part of our tradition. And I thought, well, nor is the banana. And these are things we've integrated into our daily cultures of consumption. And cultures change very quickly. And I agree with you, substitution, I think, it has proven itself as a very effective therapeutic intervention against injecting heroin use, for instance. Very effective. Buprenorphine, methadone, if they're made available in consumption rooms, in the supervised, that's good. I do think, though, that this is part of being on the back foot. We're always on the back foot in the drug policy reform movement by saying, oh, we're addressing the problems. And I think we should say, no, really, these problems, they didn't exist. We didn't have heroin use on a large scale before the closing down of our opium supply. And we need to say that actually there's a human desire, a human drive for both experimentation and for seeking the various forms of pleasure we get through these naturally occurring substances. And in a globalized market where we're exposed to products and influences from all over the world, we should also have access to the products that help us to play with our mental states. I don't like the term altered state because it presumes there's a normality of an unaltered state. Let us play with different states and have access to naturally occurring substances for which there is a cultural experience of use. And we should demand access to it. And we have the history. When that is denied, when those options are closed, then we are always moving by what's been termed the iron law of prohibition into more harmful substances. Opium shops were closed in the United States in the early 20th century. And now we have fentanyl epidemics, and bring it back, bring back the opium den, people would be saying. The harms are so much less. So what I'm advocating for, and I thank you for saying that you're operating in Brussels. Brussels is for us Europeans the place to be active in. We need to engage with the Commission, and we need to engage with Parliament, and we need to be coordinated, I think. Yes, thank you for answering the question and giving me the time.
Thank you. It's always It's always refreshing having debate with you, Axel. And I would only echo what you said. So I only add one of the things to the debate about the culture. I mean, do we have actually only national cultures today or European culture? Do we not have a global culture now with a globalized world? I could name thousands of things that get globalized. It was culturally done or used somewhere in, I don't know, Peru, ayahuasca. Today is global, etc., etc. I mean, if we look at the traditional medicine, I mean, can we have traditional medicine only localized in Peru, for example, or I don't know, Southeast Asia? Not anymore. I think we need to accept that we live in a globalized world and culture spreads and people look for alternatives to anything. People want to self-medicate and want to go to pharmacological companies. I don't blame them. And they want to have herbal possibilities, or how popular today is Asian medicine in Europe. I mean, what is it? Should we ban it because it's not culturally appropriate to Europeans? I think it's the same behavior and issue. And as you said, culture change very quickly, and we are in global culture today. So people search for possibilities. Thousands of people every month go to Peru to experience ayahuasca. Experience somewhere in the forest. I think we need to give a corridor. I know we need to do it the European way, but we need to admit that this culture cannot be something that we, I don't know how do I say that, defend as if it's I don't have the wording for it, yes, but I think we need to accept that there's number of things that we can actually learn from and accept. As the Roman Empire brought different kind of good things to Europe from or Roman Empire from other cultures, we have to do the same, I think, today.
And let me just add that together with Rhys mentioned globalization effects, we are also dealing with much more powerful and attractive scaling channels like the various social platforms, media, where otherwise local trend or some, let's say, small cultural phenomenon can very quickly get its virality and in fact get spread across large population groups, even with some trendy, catchy connotations, which might or not or might not be relevant and right, but it does not change anything on their virality, and we simply have to count with that fact that just prohibiting or limiting access, in fact, would not change the attractivity and motivation of the people to seek alternative routes. And with social platforms and various online communicators in hand, you will always find a shortcut to anything what in your country or in your area may be somehow prohibited and limited, but it will not prohibit and limit it the person who is seeking it to access it.
If Dr. Mravchik was here today, he would, I'm sure, put the U curve where he says, well, you have two tips or the tops of the U curve where you have prohibition, which means non-regulated illicit market, very risky, and creating additional unwanted risks. And then you have the total free market with no restrictions, for example, no ban to sell to underage, etc. So these are the two two most risky, but something in the middle. That's what we should look at. What it is, it's always a debate.
Yes, I was just just maybe very slightly sort of not exactly off topic, but a few of the comments that were mentioned, Dr. Klein, Jindrik, you mentioned things related to a drug that is associated to a culture. And you mentioned, Jindrik, the example of Peru. And I was just thinking, although this is a slightly different example, but I was thinking Afghanistan. Afghanistan, traditionally opium producer, big campaigns, we have to burn the poppy fields, the UNODC, extremely proud of the fact that all the poppy fields have been destroyed. There's been a 95% reduction in opium cultivation, and of course in consumption there's been. But opium, I think Indrish can confirm this, we both have worked in Afghanistan, being the country it is, it was used as obviously without people not having access to medicines, it was used as a form of palliating pain, for example, given to children, not promoting it, very bad. It led to addictions, indeed. So what we are seeing now in Afghanistan specifically is no poppy fields. The Taliban shadow, whatever, it's not government, Taliban people who are leading the country are proud of it. They've ticked, everything has been ticked, like we're doing very well in international standards. However, we know that there is ephedrine bushes grown in massive quantities in Afghanistan. So we're having is now, what was it, let's say, I'm putting it very clumsily, I think, and I'm absolutely no expert in drugs, but we had a culture where some harmful, maybe less harmful drug such as opium was used, and now the percentage of meth users is growing drastically in Afghanistan. They're injecting, they're sharing needles. I believe Indrik was in Kabul. You were there, like what, not even a year ago, less, and even had some discussions with the Ministry of Health, the Talib minister of whatever health department they have at the moment, and even they're concerned. However, that's the government that's growing the ephedrine bushes and whatnot. So just adding a sort of a comment of an interesting example we have worldwide, which doesn't quite fit in the discussion, but just here and there.
Just touch on this one. First time I came to Afghanistan, January 2005, and then already we argued that Afghanistan should be allowed to produce morphine. It's only 11 countries with the allowance of with the license to produce. Of course, the big producers like Turkey, India, France are against it, saying that security-wise it's problem. I mean, if you allow private companies to produce, you would probably have much more security and less leak into what it was. Okay, Taliban government took over. I was there about a year ago and something. And yes, many poppy fields disappeared. But yes, there's thousands of hectares of ephedra bushes, which people who cannot read and write never seen in their life, and they're now growing it. So who organizes it? Not the people. Whose idea was it? Not the simple farmers. Somebody brought it in within a couple of years, made thousands of hectares and factories, hundreds of factories of production of ephedrine. So who is it? Organized crime. Who is behind the organized crime? Enemy states. This is the only answer, no other option. So anyway, any other comments or questions? Because I talk too much sometimes. So please, floor is yours. let's summarize. Pavel, if you want to say anything, any of you want to say anything to summarize, and then I will close it today, Friday.
Thanks. I think we already wrap it up, even with this interesting analogs from history. And I might just summarize what we are seeing also in other medical area, that in fact in the profoundly changing society, globalizing, and in fact interconnecting thanks to the information and communication technologies in ways where we are still learning what are the pros and cons of such connections. Of course, also the other areas of public policies have to evolve. So thinking that the already evidently outdated regime of one of the extreme regulations as the prohibition would work either for illicit substances or the illicit substances like tobacco without any reasonable rational balance in between limiting the access to vulnerable groups, but at the same time betting on individuals' willingness to keep its life in good quality would simply not work, and we will probably in this interconnected world seeing it faster than how the evidence about failing war on drugs start arising.
Okay, thank you, Pavel. So if I may, I will say a few words at the end. One of the things is technical, practical. We want to make some summary of what was said, put it on media, social media. So if any of you who spoke here would have any objection, then let us know. But otherwise, we will want to make it public. And let's continue the debate. I want to set up kind of a forum or network, and I think it's very important, as Axel mentioned, and we also think that we need to kind of work globally, but it means to kind of agree on the rhetorics, agree on the yes, the rhetorics, the wording, let's say, yes. So I think it's quite important because when we say prohibition, people can have different kind of definition on it. When we say harm reduction, people imagine different kind of things. When we say substituted market or regulated market with lower risk substances, again, we can have different kind of. So I think it's important to make the wording properly, so we can all use it and we understand what we're talking about. Yes, we are in the preparation of the new proposals of the regulation of WHO on tobacco. We are a little bit fearing that it's going to go the same way as with cannabis or other drugs, instead of looking at evidence. So I hope we will have enough voices and people who know how prohibition can be actually a risky solution. Especially us who came from the drugs policy, the illicit drugs policy, we are very strong on this one. So I think it's quite important to continue with this debate and kind of unite the efforts. And the last thing, not least, I think is the whole issue of where the money goes and what's happening actually with the illicit market. See, to underscore the issue that actually the illicit market is not only a matter of security, as it was said today, but a matter of defense today. That it's the money from the illicit market, it's actually higher risk than any kind of health risks, when in a way, because it's flowing to the hands which can actually lead to much worse problems that we can even imagine now. So I hope there's going to be enough voices growing, and in this sense, I want to close this seminar, and thank you everybody for taking part.
Thank you very much as well. Thank you.
Bye.
Bye-bye.
Zawrzeliśmy to?